Now, health sector stakeholders have called for fair distribution of national hospitals across Nigeria. This was disclosed during a public hearing on 4 health bills by House of Representatives Committee on Specialty Healthcare in Abuja. Representing Minister of State for Health, Dr. Isiak Adekunle, a ministry official, Mr. Jimoh Salahudeen, voiced support for establishing specialized hospitals. Civil society groups, through Dr. Peters Ogumaye of Sustainable Health, also backed this move, urging that women-focused hospitals be clearly designated.
Governments are already addressing orthopedic interventions by establishing trauma centers in some of the federal tertiary institutions like National Hospital Abuja, University of Maiduguri Teaching Hospital, Borno, and University of Abuja Teaching Hospitals. The accident and emergency unit of the above-mentioned federal hospitals should be strengthened. In view of paragraph 5 above, it is advised that the National Tertiary Health Institution Standard Committee come up with standards to govern the establishment of tertiary hospitals in Nigeria, which will be transmitted to National Assembly in order to act as a guide in the establishment of federal tertiary hospitals in Nigeria to avoid haphazard proliferation. However, the Honorable Committee is humbly invited to consider the attached draft bill on the Act to establish National Obstetrics Fistula Center for adoption.
I'm inviting the committee to see the importance of conversion of this facility to help us continue so that they can continue with what they have been doing. The issues around fistula has been like driving the patient away from the facility. The stigma has made the facility not to serve the purpose of why the center was established. They don't want to associate with stigma of fistula. Then limited scope. Because of the name, the service has been limited.
Committee Chairman Honorable Egbona reaffirmed the House's commitment to improving healthcare through legislation. He highlighted 4 bills proposing new specialized hospitals for obstetrics, fistula treatment, and orthopedic care in Katsina, Zamfara, Kebbi, and Sokoto states. He stressed the importance of these institutions for treatment, research, and training, assuring stakeholders of prompt legislative action.
The 4 bills generally seek to provide legislative and legal framework for the establishment of the listed health institution to facilitate treatment, rehabilitation, reintegration, research, and training of obstetric fistula, and also to provide for the establishment of orthopedic hospital in all parts of the country under the control of the Orthopaedic Management Hospital Board affiliated to the respective teaching hospitals, and to extend to essential specialty hospital health facilities and services across the other parts of the country. It is therefore our hope that our various deliberation, opinions, and submission of these bills today will assist the committee in its report to the House for further legislative actions. The public hearing therefore opened a window of participation to identify identified stakeholders and indeed all Nigerians in line with the inclusive and participatory legislative agenda of the 10th Assembly.